in vitro fertilization or IVF treatment in South Africa. In this video, we'll talk about the cost, the process, and the success rate. Hello, and welcome to Joburg Fertility Center. At Joburg Fertility Center, we are dedicated to turning dreams of parenthood into reality. As leaders in advanced reproductive care, we provide cutting-edge fertility treatment tailored to each patient's journey. My name is Dr. J.E. Moloi, and I'm a fertility specialist. I will be taking you through complete and detailed explanation of in vitro fertilization, commonly known as IVF. If you have been trying to conceive without success, or you have been advised to consider IVF, this video is specially designed to give you a clear, professional, and evidence-based understanding of the process. In this video, I will explain what is IVF, who requires it, how the procedure is performed step by step, what are the success rate, possible risk involved, and what you can expect in terms of costs and outcome. By the end of this video, you'll have a comprehensive understanding of IVF and how it may help you achieve pregnancy. What is IVF? In vitro fertilization is an advanced fertility treatment in which a fertilization occurs outside the body in a controlled laboratory environment. In natural conception, the eggs and the sperm meet within the fallopian tube and fertilization takes place internally. However, in IVF, we retrieve the eggs from the ovaries and combine them with the sperm in the laboratory. Once the fertilization occurs and the embryo develops, we then transfer the embryo into the uterus to achieve pregnancy. This technique allows us to bypass several causes of infertility and significantly improve the chances of conception in many patients. Who may require IVF? IVF is indicated in a variety of clinical conditions. One of the most common indications is blocked or damaged fallopian tubes, where the eggs and the sperm cannot meet naturally. IVF completely bypasses the fallopian tubes, making it an effective solution to such cases. Another important indication is male factor infertility. This includes conditions such as low sperm count, poor sperm motility, or abnormal sperm morphology. In more severe cases, a specialized technique called ICSI, where there is a single sperm which is used to be injected directly into the eggs, is used to improve fertilization rates. IVF is also recommended in patients with endometriosis, a condition that affects pelvic organs and can interfere with both the egg quality and implantation. Age is another critical factor. Women above the age of 45 often experience decline in egg quality and quantity, making IVF more effective option for this category of patient. In addition, IVF is also used in cases of unexplained infertility where all investigations appear normal, but the pregnancy has not occurred. It is also important option for couple with genetic concern, where pre-implantation genetic testing, known as PGT, can be performed to select chromosomal normal embryos. Now, I'm going to explain to you IVF step by step. The IVF process begins with ovarian stimulation. In this phase, the patient receives hormones injection over a period of approximately 8 to 12 days. The purpose of this medication is to stimulate the ovaries to produce multiple eggs rather than a single egg that is typically produced in a natural cycle. During this period, the patient is closely monitored using ultrasound scan and blood tests to assess follicular development and hormone levels. Once the follicles have reached an approximate size, a trigger injection is administered. This injection is critical as it induces the final maturation of the egg. Egg collection is then scheduled approximately 36 to 40 hours after the trigger injection. Egg collection is performed under sedation and is minimal invasive procedure. Using ultrasound guidance, a needle is passed through the vaginal wall into the ovaries to retrieve the eggs. The procedure usually takes about 20 to 30 minutes. On the same day of egg retrieval or collection, a sperm sample is collected and prepared in the laboratory. The embryologist team then proceed with fertilization. In a standard IVF, eggs and sperm are combined and allowed to fertilize naturally. In case of male factor infertility, ICSI is performed where a single sperm is identified and used to inject directly into the egg. After fertilization, the eggs are cultured in the laboratory for several days, typically between 3 and 5 days. During this time, embryologists carefully monitor the development and quality of the embryos. If indicated, pre-implantation genetic testing can be performed at this stage to assess for chromosomal abnormalities. This allows for the selection of the most viable embryo, thereby improving implantation rate and reducing the risk of miscarriage. The next step is called embryo transfer. This is a simple and painful process that does not require any anesthesia or any pain medication. The selected embryo is carefully placed into the uterus using a fine catheter and under ultrasound guidance. Following this transfer, the patient enters what is commonly referred as a 2-week waiting period. This is the period before pregnancy is performed, pregnancy test, usually 10 to 14 days after the transfer. Let's talk about the success rate of IVF. The success rate of IVF depends on multiple factors, with age being the most significant important factor. In women under the age of 35, success rate can be as high as 40 to 65% per cycle. Between the ages of 35 and 40, success rate range between 30 and 45%. In a woman above 40, success rate declined significantly, often ranging between 10 and 25%. Other important factors include sperm quality, uterine cavity health, and the presence of conditions such as fibroids or hydrosalpines. At Joburg Fertility Center, we optimize the outcome through individualized treatment protocol, advanced laboratory technique, and the use of genetic testing where appropriate. IVF is a medical procedure. Like all other medical procedure, it does have complication and risk. IVF is generally a safe procedure. However, there are some risks to be aware of. One of the main risks is ovarian hyperstimulation syndrome, where the ovaries becomes enlarged and fluid may accumulate in the abdomen. This is carefully monitored and prevented with appropriate protocols. There is also a risk of multiple pregnancy if more than one embryo is transferred. For this reason, single embryo transfer is often recommended to reduce this risk. Another possible outcome is failed implantation, where the embryo does not attach to the uterus. This can be emotionally challenging and may require further cycles. Let's not forget the most important factor or risk in IVF, emotional stress. It's also very important and we should consider it. A fertility treatment can be psychologically extremely demanding, and it's very important that as fertility specialists, we work and guide with compassion and empathy, understand the patient, and understand that stress is common in these patients. Lastly, let's talk about the costs, the cost of IVF, which causes also a financial stress. It's got direct psychological impact on the patient because IVF is relatively very expensive. And in Joburg Fertility Center, we are aware of this factor and we always assist our patient to achieve pregnancy with minimal cost as possible. Our IVF treatment ranges probably something from 90,000 close to around 160,000. And it's better to individualize patient so that you can be able to lower the costs. We will give you a full breakdown of the cost from the start to the end of the process. If you are experiencing difficulty in conceiving, it is important not to delay seeking medical evaluation. Fertility decline with age, and early intervention can significantly improve the outcome. Maintaining a healthy lifestyle is also extremely essential. This includes achieving a healthy weight, avoiding smoking and alcohol, managing stress, and taking appropriate or prescribed supplements. Most importantly, each patient is unique and treatment should always be individualized. At Joburg Fertility Center, we are dedicated to helping you achieve your dream of becoming a parent. And our team is ready to guide you through every step of your fertility journey. You are welcome to book a consultation where we will assess your condition and develop a personalized treatment plan. Thank you for watching this video. If you found this information helpful, please like, subscribe, and share this video with others.